Yep. Hello, guys. Welcome to today's talk organized by Cambridge SEMSOC on how to get an elective in sports and exercise medicine. So today we have three final year students, Isabella, who did her elective in Australia, Vythi, who did his in South Africa, and me, my name is Clement, and I did mine in Hong Kong. So please take it away, Isabella.
Fun. Okay, I'll just share my screen. I hope it's gonna work. Hold on. Sorry. 1 second. I've got too many PowerPoints open. And it's not letting me share. I think you can see my screen now, I hope.
Yeah, we can.
Yes, okay.
Yeah.
And is it full screen now, the PowerPoint?
Yes.
Yeah. Okay, cool. So, hey everyone, I'm Isabella. I'm a final year medical student, as Clement said, and I did my part of my elective in sports and exercise medicine, and I did that in Australia, specifically in Melbourne and the Gold Coast. So I'm going to tell you a little bit about how I got my elective and what I did. And here's also my email in case you have any questions. We'll do a question and answers at the end, I think, but you can always drop me an email as well. So how did I get my elective? This is a screenshot of my wonderful Excel sheet that I used to sort out my elective. I knew I wanted to go to Australia, and I kind of just found anything I could. First, like official programs at hospitals, but those tend to not all be sports medicine related, or actually maybe not sports medicine. I actually did 4 weeks at St. Vincent's Hospital, which is highlighted in green on my spreadsheet, and I did it in cardiology, and it turns out that there's 2 sports cardiologists there too, which I didn't know when I applied, but that was good. And then for other things, just get in touch with people. So I just found and Googled lots of people who do sports medicine in Australia and literally just emailed everyone, sent my CV, said that I'd like to come. And didn't hear back from most of them, to be honest, but heard back from a few and got a place with Dr. Tim Wood. And yeah, apart from that, I think LinkedIn is also a great resource. It's not something I use personally, but it's also a good place to find people and to reach out. And it's easy to find people who've got something in common with, like for example, if they studied at Cambridge or something, and that's an easy way to like start a conversation. So yeah. So my SEM elective was with Dr. Tim Wood, who has a joint clinic with Dr. Chris Hasenkamp. They're both SEM consultants. Dr. Tim Wood studied at the University of Bristol, and he was also the chief medical officer to Tennis Australia and the Australian Open for 15 years. And apart from that, he does a lot of AFL stuff. So yeah, and I think that's one of the reasons, and that's a big part of my CV, and I think he enjoyed that. And then Dr. Chris Hasenkamp, who works with him, he went to the University of Melbourne, and he's also a doctor for Cricket Victoria and the Australian cricket team. And as for AFL, he does the Sydney Swans. So in Australia, anyone who's a SEM consultant will have a AFL team because there's just so many. And Dr. Chris Hasenkamp, he was actually a student when Tim was already a working physician. And when he was a student, he reached out to Tim and was like, oh, can I come shadow for a day? And that's kind of how his career started. And he ended up, working in Tim's clinic, and they now have a joint clinic together. So again, like what I said before, is just reach out to people and see where it takes you. So this is walking into the clinic. If you're a tennis fan, you'll recognize the guy on the left, Roger Federer, signed a letter to him saying thank you for his work at the Australian Open. And on the right, the Australian women's cricket team, champions. They won a lot of things many years in a row. And this was a thank you to Chris for all his work with them. So yeah, just trying to show you that. It's quite cool. A day in my elective. Apart from the elective being a chance to experience, medicine and sports medicine, because we don't get much of that at uni. I think elective is also about having fun. So on the left, the first photo is Tim's clinic on the Gold Coast. So I was mainly with him in Melbourne, but then he also took me up to the Gold Coast, which is a bit further north, and that's the view of the ocean from his office. It's not a bad life. Second picture is a tennis court on the Gold Coast where I played tennis with him. Don't ask me who won. It was a close match. And the third photo is a picture of Byron Bay, which is close to the Gold Coast, and I got a chance to see that as well while I was up there. And then a photo of me, because I thought I should probably put one in this presentation. That was also part of my elective. Apart from that, I also did some other things with them. So one day I went to a Kieser physiotherapy clinic and learned a lot about the physio. So a lot of the referrals that were made from Tim and Chris were to this physio clinic. So they wanted me to be able to see, what they're actually referring to, what people do there. I also spent a day at a specialized MSK radiology clinic where a lot of Tim and Chris's patients get their scans done. So that was quite cool as well. And otherwise, yeah, just spent time in different clinics with both Tim and Chris, and also saw different types of patients just because, the Gold Coast is a different type of population than Melbourne, for example. So that was quite interesting as well. So the types of cases I saw some professional athletes, was quite cool. Unfortunately, not allowed to tell you who. But what I learned with that was that it's actually very complex to manage them. So your first priority is getting them back as soon as possible if they're injured at the moment. Or what we had, there was one person who needed a surgery at some point, a shoulder surgery. But the question was when, would she be able to survive the season a little bit longer? Is there a good time in the season to have a surgery? When, at what point in the next season would her recovery end? And then her personal doctor came to that consultation as well. And then, her manager was involved, the coach had to be informed. So kind of just learning about how multifaceted treating professional athletes is. AFL concussions, so lots and lots and lots of AFL concussions. In Australia, there's a lot in the media at the moment about concussions and their long-term effects. So it turned out that patients were very informed and also to some extent worried about that. So they would ask specific and certain questions about what this could mean for them, or if it was a parent, they'd be like, "Oh, can my child keep playing?" and so on. So that was also a challenge of having people who are very informed about a topic, but that might also be misrepresented in the media. Then the role of a team doctor. So with Chris, I actually also got the chance to go to Cricket Victoria, saw some of the athletes there and was able to chat with them, and also saw what kind of responsibilities he has. So for example, he checked their regular blood tests, and he'll be kind of the first person to pick up if something's out of line, and then to be able to investigate that. So that was really interesting as well. And also in terms of that, so on the left here, the photo is actually the Women's Football World Cup, which was happening at the time I was there. I was lucky enough to get tickets. But that is, for example, also something cool you could do for your elective. If there's a major tournament somewhere, you could try and get in contact with the team and see if you could shadow the doctors or the team, go with them. Think that would have been pretty cool. And just to talk about the other photo as well, that's the MCG Stadium in Melbourne. It's absolutely huge. This was an AFL game, which was really nice. And then, yeah, the last thing on my list of cases is osteoarthritis. I wanted to put this up there because as a SEM consultant, they didn't actually just see young people and athletes. There was also a lot of older people, and well, not a lot, but there were also older people. And people who were looking kind of for MSK advice, so people who they diagnosed with osteoarthritis, and that's something I didn't really know going into SEM, that this would also be a population that would be seeing these kinds of doctors. When I talked to Chris and Tim about it, they said it's also a lot about what physios you work with, because you get a lot of referrals from your physios. So naturally, whoever your physio sees is who you're going to end up seeing. But yeah, I thought that was interesting and something I definitely didn't know before I went. So that's all about my elective. As I said, I think there'll be a question and answer at the end when all three of us have finished. But here's my email address again if you have any questions, and good luck to anyone applying for some electives.
Cool. So next up we have Vythi, who did his elective in South Africa.
Hello, I'm Vythi. Clement, can you hear me? Oh, good. Because my internet's not really good at the moment. But all right, okay. Let me just share my screen. All right. Just a sec. Right, so sorry about the delay. Hi, I'm Vythi. I'm 60 medical student at Trinity Hall, Cambridge. And like Clement said, I did my elective in Cape Town, South Africa. And I would say this is probably one of my best memories of being just a medical student. And also as part of my travel, I think Cape Town is such a beautiful place and has so much to offer in terms of career opportunities as a sports and exercise medicine doctor. Um, right, right. Again, I've put my email here, but it's not that clear. But I'll let you know. And if there's anyone with any questions, feel free to ask me. With my elective application, I didn't do as intense as what Isabella did, which maybe should have done with the Excel sheet. But since Cape Town sports medicine electives didn't have any proper channels, such as hospitals or any applications that you have to go through, your only real option is to just email people. And that's pretty much what I did. I was told by a sports medicine consultant here that Cape Town and Australia are two good places to go to if you want to get an elective. And I figured I wanted to go to Africa. I wanted that experience because I've never been to that continent before. And I thought maybe I'll try Cape Town. And I just sent emails to different places. And I was lucky enough to get a reply. I think this is one of the very few replies that I got actually, with Cape Sports Medicine. So Cape Sports Medicine is the sports clinic that I worked with. It's a private clinic and it works with the Sports Institute of South Africa, which also oversees other athletes and other recreational athletes as well. So that's pretty much how I got my application process going. Sorry. So yeah, so apologies for the pictures. The pictures aren't of the greatest qualities. So K Sports Medicine was sort of my home base for 3 weeks, the 3 weeks which I did, and I kind of wish I did longer because I definitely enjoyed my time here. And as you can see on the right side, that was my view from just outside the clinic, and that's if you may not know, that's Table Mountain, which is the massive mountain overlooking the sea, and it sort of covers the whole Cape Town. And it's a gorgeous view. So that's we were very close. So on your left there, that's the entrance to Cape Sports Medicine, and on my right there, that's Dr. Adrian Bertuna, who is one of the sports consultants in the clinic. The clinic had about 11 sports and exercise medicine consultants with two knee and shoulder surgeons. So it was a very comprehensive sports medicine facilities which also included imaging. So they also had a separate section for X-rays, ultrasounds, and MRI. Well, when I was there, the MRI machine was broken because it was during winter there, but they have the whole deal basically there, and I got to see different procedures, different imaging. I would say I got a lot more confident with my ultrasound, at least just in having a look and trying to interpret what the ultrasound signs are specifically with the musculoskeletal system. I think that was something that I definitely took away from this elective. So my typical day would be I would go in at 8 in the morning, and they will give me a list of patients to see, and each patient would be assigned to a different doctor. Certain doctors specialized in certain fields. So one of the doctors I was with, Dr. Lee Gordon, who was also previously, she's worked with rugby teams before. If I remember correctly, she was she was the lead doctor for the rugby sevens team of South Africa, and now she's no longer in that position. So was specialized in concussions. So I saw a lot of patients who had concussion injuries or any medical specifically related to sports, team sports, was run by Dr. Lee Gordon. And I got the opportunity to actually help out and facilitate some of the medicals that you'd hear in the news, or this player sort of undergone a medical and science for the team. And that's something that I actually got to partake in, which I found really interesting. And one case that I would like to pick out, and that really sort of touched me, was so we worked with a football team called Cape Town Spurs. I'll come up to that later, but they had a few new signings for the new season, and obviously they were running medicals to see whether the players would be a good investment for the long-term future. And this specific player, who's I'm not going to name him, but he's played in Europe before. He's actually played in the Europa League. It's actually a pretty big achievement for him. And he's coming with knee pain, severe knee pain on both sides, and the doctors couldn't figure out at first what was wrong with him. But then after inspection, it turned out that he had severe knee degradation, tendonitis, which has gone on to be really, really bad, that he would not be a good investment for the team. And such, he failed the medical. There was a lot of erosion in his knee joints, which made not just the fact that he would not be able to sign for this team, Cape Town Spurs, but also his career as a football player is severely limited because of that, which I thought was very, very sad. And I'm sure we've come across CCS breaking bad news, but it was actually very sad to try to tell him that it's just not his job. His future job will also be in jeopardy. And he's not from here. He's from another country. So he traveled all the way to join the team, and now he said that he can't join the team and he can't possibly play in the future as well, which I thought was very, very sad. Anyway, there were some other things that I saw as well. So like I said, plenty of ultrasounds. I saw, like Isabella mentioned, I saw a lot of patients, not just athletes, but also recreational athletes, as I would say, people who would come in from an injury from hiking, or there was a farmer who had severe back pain who came in to us. A lot of children who undergo injuries in sports during their school period would come over in the afternoon to get their injuries checked out. I saw a few patients with Osgood-Schlatters, just normal pediatric conditions that you might have heard in the textbooks, but not really seen by us. But I thought these were all interesting things that I've seen. Right, I'll move on to the next one. So apart from being in the clinics, this was one of the main things that I did during my 3 weeks, which I thought was very, very cool, was with Cape Town Spurs. So Cape Town Spurs is a team based in Cape Town, rivaling Cape Town City, who are their bigger neighbors. And Cape Town Spurs, the head medical person is Dr. Adrian Ratuna, who was involved with the patient care there. And I got to see their trainings, so management of injuries and management of their day-to-day work during the training, as well as pitch-side medicine. So the picture on the right there, that was one of the matches that I luckily got to see. So I sat on the pitch side, but I was very unlucky because throughout the 90 minutes, our players had one injury, and it was right next to us. So something that I saw on the TVs where we would just run up, the physios would just run up to the players. That's something I didn't get to do. Whereas the opposite team had multiple injuries. They had quite a few frequent visits to the field. But I thought that was very, very interesting. And something that I've understood as well is that the doctors would not step in unless it's concussion or something that's a lot more serious. So most of the times the physios would be the one dealing with the immediate injuries, giving pain reliefs and such. So I got really close to the physio team in the club as well, and they gave me a few pointers on what things I should be looking out for. Obviously, the doctor taught me a few exams, a few signs that I need to spot. So I thought as in terms of medical application, this is a very, very good elective for me to sort of put some of the MSK knowledge that I've had into practice, and also learn more information specific to sports medicine related injuries. And right in the middle there, that's the head coach of Cape Town Spurs. You guys probably wouldn't know, but if you watched the Premier League back in 2005, he's Sean Bartlett, so he played for Charlton, who's a pretty top striker for them. But yeah, I wouldn't expect you guys to know. Yeah, so again, apologies for the pictures. Some of the pictures have been transferred really badly, but this is something that I really enjoyed about Cape Town. This is something outside of the medicine that I saw, and it's just that Cape Town is a very, very pretty place. That's, like I said, the Table Mountain there, which is the top left picture that you see here. That's one of the views that I got from the top of the mountain as I hiked. It's not bad. It's like a 2.5 hour, 3 hour hike, if I'm not wrong. Obviously one way, so it's about 6 hours overall. But the day I went was I vividly recall the weather being absolutely horrendous. And then down below is Kirstenbosch Botanical Gardens, which is the 7th biggest botanical gardens in the world. So it was massive and absolutely gorgeous. And to the right there, that's Cape of Good Hope. This is the point where the Portuguese came along, Albuquerque and Vasco da Gama touched this point as they continued their voyage across the east. Yeah, and I have so many other pictures that I have not put here, but Cape Town is such a pretty place, and I highly recommend for an elective and as a holiday if you guys prefer. Thank you.
Thank you very much, Vythi. I'm just going to share my slides now. Yep. So hi, my name is Clement. I did part of my elective in Hong Kong at the Hong Kong Sports Institute. Okay, so just a quick introduction. The Hong Kong Sports Institute is, so it's an institute that the Hong Kong government set up to help sponsor their athletes and train them, and it provides accommodation, training facilities, education. And I think this was really useful during the COVID pandemic, where they still had a place where they could live and train and sort of be quarantined within an area. And one other thing is that these athletes that are sponsored by the Hong Kong Sports Institute, they have to be at a certain international standard. So there are sports like table tennis, fencing, rowing, but then obviously there are sports that were not represented. So I think things like football, etc. So as you can see in the picture, there's quite a lot of space. There's like athletics complex, there's swimming, there's also rowing because it's situated by the river. So just a quick introduction to sports medicine in Hong Kong. It's mainly done by the Chinese University of Hong Kong, which is one of the two bigger universities. And from what I've been told, they work quite closely with a lot of other departments, but mainly in orthopedics. And they also do a lot of private work. And when I was in the clinics, even though I was sort of attached to the orthopedics department, there were still a lot of people from the sports medicine department. They included people like physios, occupational therapists. So my elective was split between being at the hospital and at the sports institute. So at the hospital, I was attached to the sports team of the orthopedics department. So the way they've split the ortho department is into sports, trauma, oncology, etc. And the sports team mainly deals with soft tissue injuries. So in the clinic and on the wards, it was a lot of rotator cuff tears, ACL injuries, and other just mainly sprains, which I found very interesting that they've subdivided ortho into things like soft tissue, bone, etc. I also got the opportunity to attend year 6 orthopedic teaching with other students from the Chinese University of Hong Kong. There were teaching seminars and bedside teaching that I was able to attend. There were also a few other elective students, as well as a visiting professor who I attended the surgeries and the clinics with. And it was really cool to be able to get to see some of the surgeries such as ACL reconstruction and also robotic assisted knee replacements and hip replacements. So in the picture, and the picture on the right, that's the view of the sports clinic. So it's by the athletics track. So I was with Professor Patrick Young. I think he's the main doctor that is with the Hong Kong Sports Institute. So the way the clinic is run, it's sort of like a GP service for the Sports Institute. So then athletes living there can sort of request an appointment and go see him. So during my elective there, at the time it was the World University Games. So Professor Young was spending part of the weeks traveling there to see the athletes there. And also during the clinic, the athletes would quite often attend with their coach and sometimes with like a parent. So I think it was very interesting to see how he would have to balance the needs of the coach and the training program, but also try and plan about the long-term future of the athlete. So next to this clinic room, there were also lots of facilities such as physiotherapy, massage, and acupuncture. So it was also very interesting to see how some of these alternative therapies or other services were being provided. So I'm just going to quickly talk about some of the cases I've seen. There were quite a lot of MSK injuries, so things like hamstring sprains, adductor sprains, obviously a lot of knee injuries such as ACL injuries. There were also some rare ones such as ganglion cysts, stress fractures, and the main interesting one was a C1, C2 subluxation, which was from an athletes involved in gymnastics. It was like during the World University Games, and I think the athlete had landed on the back of their neck. And initially they thought it was quite serious. They worried that either she'd broken her neck or she'd become paralyzed, but turns out, fortunately, it was just a very mild subluxation, but they were still closely monitoring her situation. And I remember that the athlete had really, really wanted to continue on with the competition and going back to the Asian Games, which was in September, which was in a month's time at the time. But I think it was all about balancing recovery and rehabilitation. So with a lot of these injuries, such as the hamstring adductor sprains, I remember it was a track athlete, and she was very concerned about recovering in time to attend the Asian Games. And the coach had also wanted her to ramp up her training to prepare for that. And I remember Professor Young really skillfully just convincing the coach that it would be better for her long term to actually take more time to recover at a very slow pace rather than trying to rush the rehab and causing further unnecessary damage. So I think I learned quite a lot in terms of, I guess, communication and handling the desires and needs of both the athlete and the coach. I think that's quite different from a traditional sort of doctor-patient relationship. So from what I've heard from Isabella and Vythi, I think that sports and exercise medicine can be quite different. So it can be you're attached to a team and you're the team doctor seeing only those athletes. You could also be sort of more like a GP, just seeing whatever problem the athlete presents with. So I think that's really quite unique. And it also can depend on the country as well. So in Hong Kong, what I found was that sports and exercise medicine was very, very closely linked to orthopedics. And there's not really like a specialty for it per se. Whereas I think in Australia, it's its own specialty that's more like a GP. So it's like completely not surgical at all. But in Hong Kong, it's pretty much all the STEM doctors are also orthopedic doctors. And secondly, I think the career depends quite highly on what the sporting scene is like. So in Hong Kong, there aren't that really many sports teams because there aren't many actual local leagues. Whereas in, I guess, South Africa, I mean, in Cape Town alone, there were 2 football teams that seemed to compete at like a decently high level. So I think sports and exercise medicine and what you make of it is very dependent on where you are as well. So yeah, thank you for coming. That's the end of my talk. I think now we're just going to have a quick short Q&A session for the 3 of us. So if you put your questions in the chat or if you unmute yourself and ask a question, I'm sure we'd be happy to answer any of them.
Hi.
Hey.
If you had to go back in time and change something about each of your elective plans in advance, what would it be?
I think personally, I would have done my whole 7 weeks in sports medicine. I did 4 weeks cardio and 3 weeks sports medicine. And in hindsight, it's just, I don't know, something you don't get at uni if you're interested. I think there's loads of opportunities.
Yeah, I do agree. I think I did way too short. Mine was 3 weeks. So I think 7 weeks would have been ideal.
I think personally for me, I would have probably tried to plan and organize everything earlier. Similar to Isabella, I also emailed and contacted a lot of people in Australia. I received a few responses, but none of them actually, gave me an opportunity. Whereas I think what Isabella did was she'd already started emailing just over a year before. So I think her elective was in July-ish. She was already emailing them May the year before. Whereas I think by the time I'd emailed, like probably September to December, I think either a lot of the spaces were already filled up or they were no longer taking any applications. So I think the main thing I would have done was just to plan and apply earlier.
Great talk. Thanks, guys.
Okay, so there's a question in the chat. So in regards to funding, I think the funding greatly depends on what college you're at. So some colleges have funds for research / electives. There's also, I think, a grant that you can apply for from the, is it British Association of Sports and Exercise Medicine? So I think they do a grant for electives and you have to submit an application for your proposal. I'd say it's mainly a combination of funding from college and also just self-funding. Do you guys have anything to add to that?
There's also the NHS funding, but I think that's only for domestic students and like not even EU, just like British. But that's quite generous for accommodation, I think, like £55 a night or something like that.
Yeah, my college is a bit generous. I got £1,500, but there are, like Clement and Isabella mentioned, some other ways that you can get funding as well. I got lucky. My sponsor sort of gave me some money, but with regards to planning, I agree with Clement. I think if you plan earlier, then there's ways that you can sort of negate the extra cost with the flights being a bit cheaper, the accommodations being cheaper, things like that.
And also, I guess with the planning and applications, I think Isabella did a mixture of applying through universities and emailing people. And I think both are viable options. So my elective, I was just cold emailing a lot of people, and for my for Professor Young, I found his email online and I just wrote an email introducing myself and telling him that I was interested in getting more experience in sports and exercise medicine. And he just managed to reply back to me and tell me how to officially apply through the university. I think just cold emailing people will also help. If there are no more questions, I think that'll be it for today. Feel free to email or message the Cambridge SEMSOC page, and we'll be happy to answer any questions that you have. And this talk has also been recorded and will also be uploaded to the YouTube channel. So thank you very much for coming, guys.
Thank you for your time and effort.
Thanks,
Thanks,
guys.
guys.
All right, bye.